Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Lene here. It's Friday. Not going to give the date because I don't want to lock myself into the date, but it's a Friday. I left Tripp at home, but Hayden still had school. My little Huckleberry still had school, so I had to get up early, drop him off at school, and came in to the office to do some work that I didn't get done this week, and also to interview this guest that I'm about to introduce you to. I think it's going to be fascinating. We've not had a guest like this on yet. So without any more ado, I'm just going to jump right in and let you know that today we're going to be talking to Dr. Joel Pash. He's the co-founder of the Upsize Clinic and the medical director of its San Francisco location. He completed medical school at Midwestern University in 2006, went on to complete a residency in anesthesiology at the University of Calgary. Since finishing his residency in 2011, he has performed thousands of complex injectable procedures, including nerve blocks, epidurals, and spinal injections, intravenous and arterial catheters, and penile injections. He has published academic papers on subjects such as operating room management and pain management, and he's on the staff of several hospitals, in Northern California, as well as the two Upsize Clinic locations. In case you haven't figured it out yet, we're going to be talking about penile enhancement with Dr. Joel Pash. Thank you so much for taking time out of your day to join us.
Thanks for having me. Nice to be here.
Yeah, so I'm pretty sure we've not had a guest with your level of expertise on this particular topic so far. So I'm sure the listeners will be interested in learning something that we haven't talked about before. Before we jump in, can you tell the listeners what was the spark that brought you into passion for penile enlargement?
I don't think it's not as exciting a story as you would assume. I'm an anesthesiologist by training. So that's a lot of injectable procedures. That's the background that kind of makes this work. I had a business background before I was in medicine. I did management consulting for several years. So I thought I was just going to be an anesthesiologist, and I just started kind of looking for really just business opportunities. And someone I met had told me about this procedure, which I had not heard of. I never thought about getting in a million years. I never thought I would be doing this. But nonetheless, I looked into it, and it turns out it's effective, it works, and there's a need for it. So about 3 years ago, started this practice, and it's been growing ever since.
And the practice's name, Upsize Matters?
The practice, so there's a few layers. We have an actual medical practice that's just like a doctor's office. So that's a professional corporation or whatever, and I work at it, and so does my business partner. There's a franchise that I own called Upsize Clinic, and Upsize Clinic is made up of about, at this point, 14 different medical practices run by different doctors, and each of them do the penile enlargement procedure that we've I don't want to say invented, but that we've crafted and perfected, so to speak. a lot of those doctors' offices do other things too, just like doctors' offices do. Like, for example, you're an integrative health practice, so you do all kinds of things. And imagining, for example, bioidentical hormones is one of them. So
Sure.
in our doctors' practices, penile enlargement is one of the things they do.
Cool. And so so it's injectables, like dermal fillers for the face, but going somewhere else.
Yeah, exactly. The there's different types of dermal fillers and most of them are intended for injection in the face. The ones we use are hyaluronic acid fillers, which typically are indicated for injecting in the cheeks and the lips, and around the eyes. So it's the same fillers. But in this case, they're being used to make the penis thicker. Because they're those same fillers, that's kind of one of the things that makes the procedure safe. Fillers are widely used. They've been used for 15 to 20 years and have a really low risk of complications.
What would be an example of a complication?
Well, anytime I tell my patients, anytime you have a medical procedure, there's a possibility of a complication. In this case, it's injectable. So essentially, you have a needle going underneath the skin in your penis. So when you put a needle in something, there's possibility of damaging things that are around that needle. So, for example, blood vessels, nerves, the skin itself. You can also have an infection. Um, and in fact, if we were to have a complication, which is very rare, an infection would typically be the thing that it would be. Having said that, I've probably done 700 procedures and I've seen 2 infections, and they both just gone away with, routine antibiotics. I've never seen any serious complications from the procedure. So compared to other medical procedures, it's actually very safe.
Cool.
Certainly compared to surgery that does the same thing.
Oh, for sure. Trip, you have a thought?
Well, no, I was actually going back to thinking about, I know there's probably some of our listeners are thinking, well, there's a lot of stuff out there on the internet and all this stuff that is, I spend a lot of my time debunking things that
Creams?
are well, all sorts of stuff, pills, creams, whatever. I mean, I'd really be kind of interested in a little background there if you've got some things that would help our listeners avoid things that really are worthless and or have not been proven to be effective. That would be really helpful also. I think that I'm certainly interested in the procedure, but I think there probably people go through a thought process, in my mind at least. They go through a thought process that goes from wanting to take a pill to then getting into a procedure. And if you have any thoughts there, I'm sure you see it so much more frequently than I do. I'd really love your perspective on it.
Yeah, so that you raise one of the big problems with this business and this type of medical practice, which is that the assumption when people see penis enlargement is that it's a scam, because so many things out there are a scam, and guys will kind of buy or pay for anything that might help. So I guess basically you could break it down into pills, stretching devices and pumps, and then medical procedures. So I think, and within medical procedures, essentially there's dermal filler procedures, and then there's like some surgical procedures, usually involving implanting some sort of material underneath the skin. I'm sorry, go ahead.
Oh, no, I was saying that sounds scary.
It is, yeah. And not only is it scary because you need to cut open the penis and deglove the skin and all that, but it's essentially causing the same. It's essentially the same effect that we're doing just by injecting the material without having to cut anything. That, in other words, the material goes in the same space and is intended to do the same thing, but we inject it, and surgeries have to cut everything open and implant physical things. Anyways, yeah, I mean,
Yes.
you get scarring, you get erectile dysfunction, you can have erosion of the thing through the skin, causing infection. Like they're horrible in my opinion, but there's, as we just alluded to, there's people that will kind of do anything when it comes to their penis, even if it's a bad idea. So going back to that though, pretty much all the pills are probably a scam. I think some of so there's no actual prescription or FDA approved medication, obviously, to make your penis larger. I think some of the pills, to the extent that people think they're effective, are probably having some effect on erectile function or like a Viagra type effect. But the problem is we don't really know what's in them or how it's working. And they're certainly not actually causing the penis to be enlarged. So there's that. Then you have things like pumps, which do cause a temporary increase in the size, but do not have any sort of long-term effect. Stretching devices, where you essentially hook something onto the head of the penis and it just literally applies stretch over a period of time. So those actually can be actually effective. They sound like it's a torture device.
Does sound like a torture device.
Ouch.
But again, people will do anything, even as far as all the crazy things that people will do, that's actually not that crazy. Like from a medical perspective, it's essentially a tissue expander. It's applying constant pressure, constant stretch long term. And eventually, if you do that, tissue starts remodeling into that longer form factor. So it's the same as it's a similar concept to if you put on a ton of weight and you have a bunch of fat, eventually your skin will just stretch out. And then even if you get rid of the fat, it's still going to be stretched out, saggy skin. So it's kind of a similar effect there. It does work. It's a process, and it just gives you a long, skinny penis. It doesn't give you like, right, exactly. It's not, so like it works, but it's not like it's not exactly probably what people are looking for. It kind of uniquely can be synergistic with what we do because we make everything thicker. And in fact, we used to sell a device that did that, but for various reasons, we don't sell it anymore. So there's that. So in other words, between pills, pumps, and stretchers, pills are a 0 out of 10. Pumps are a 1 out of 10. Stretchers are like a 3 out of 10. And then there's injectable things. So essentially, you have PRP or the P shot. I do not believe that works.
I would like for you to delve deeper on that because I hear a lot about that. So why doesn't that work?
Well, I can't say for sure it doesn't work. We'd have to look at. I don't believe there's any research that shows that that works, at least long term. PRP is basically platelet rich plasma. So it's your blood that's rich with platelets. I'm assuming you guys use that somehow in your medical practice. The issue is that there's evidence that PRP works in areas like, for example, joints or tennis elbow or something like that. And typically that's in areas that have reduced blood flow. So you're injecting growth factors essentially that are concentrated in the PRP into usually a closed space where they don't have good blood flow. And so the thought is that by injecting that, you could kind of encourage tissue formation or whatever. Now, yeah, tissue repair. So when in the PRP injected in the penis is injected into the corpus cavernosum. So corpus cavernosum is essentially a big blood vessel. Okay, so it's almost as if you're processing the PRP and then injecting it right back into your vein. So it's like you're taking your blood out, you're processing it, and you're putting it right back into your blood. Now you're just exactly where you started with a little bit without some white blood cells or whatever. So plausibly, it doesn't seem like it would do anything. And again, the difference between that and injecting in a joint is the joint doesn't have blood flow, or at least substantial blood flow. So the PRP stays there for a period of time and has a chance to do its effect. But when you put it in the penis, it just immediately almost recirculates into your vascular system, and it's not there anymore.
Got it.
Plus, I'm not sure that, yeah, I mean, even if it did stay there, who's to say that platelet and growth factors is going to permanently increase the size and thickness of your penis? Like, that's not necessarily plausible either. So anyways, that's my opinion on it. The same can be said for injecting PRP into blood vessels in general. I just don't see how it would do anything. Then we have injection of things like Botox into the corpus cavernosum. Now, Botox works by essentially killing the neuromuscular junction, right? So when we inject that, we use a tourniquet on the penis. We inject it and we let it kind of bathe in that area for about 20 minutes. And what the Botox does is it causes a decrease in contraction of cavernosal smooth muscle. Okay, so your blood vessels are made up of smooth muscle, and when the smooth muscle is relaxed, you get an erection, and when it's constricted, that's your normal state. So in this case, if you inject Botox, it causes, in theory, an increase in blood flow. Okay, so that kind of works, and we do offer that. Now, it's not a permanent thing, and it doesn't actually make your penis bigger, but it causes more blood flow in there for, let's say, 6 months. So it makes it easier to get an erection, and it makes your penis appear larger most of the time. Then we have dermal filler, which definitely works. You're actually injecting a substance underneath the skin to make it thicker. So you're factually injecting a material in there, and it stays there until your body metabolizes it, which in our case, we're using hyaluronic acid filler. Lasts an average of 2 years in the area that we're injecting it.
Huh.
And then you have surgeries, which again, before they work, but they have quite a bit of risks. They're expensive and they're not reversible. So if you do have complications, it can be very difficult to fix them, and usually need surgery to fix them. And the more surgery you do on your penis, the worse it's going to be.
Yeah, it sounds terrible. What so you said one dermal procedure can last up to 2.5 years?
It can. I tell people the average is 2 years. In the face, like in the lips, for example, it's usually 6 to 8 months. The lips are very vascular. So there's a lot of blood flow, and the filler is being injected very close to that vasculature. Your body has an enzyme that breaks down that filler. So the more blood flow around there, then the faster it's going to be broken down. In the area we're injecting in the penis, it's in between two fascial layers that don't have a lot of blood flow. The head of the penis has blood flow, and the corpus cavernosum, which is the functional part of the penis, has blood flow, but just the skin and underneath the skin and stuff is not super vascular.
Oh, okay.
So in other words, where we're injecting it is not super vascular, so it tends to last a lot longer.
Depending
That's
on
obviously an
activity. That's
Well,
depending.
it could, yeah. I mean, well, like I don't think sexual activity per se, but I think people that are more physically active, that are running marathons every week and stuff like that, generally have higher metabolisms, and everything is being, broken down and regenerated faster than a sedentary person. But generally speaking, it's to do with the blood flow and the level of enzyme that's naturally in your body. So there's an enzyme called hyaluronidase, which is what breaks down hyaluronic acid. Both of those substances are natural to your body. So genetically, some people just have more and some have less. And some people that have more would technically break down that filler faster.
Got it.
Which is why there's an average, right? Like if we were injecting, I don't know, plastic into your skin, not that we would, but I'm just using an extreme example. If we were, your body's not breaking it down, so it just lasts the same amount of time in everyone, which is forever, right?
Right.
Any
Fascinating.
any thoughts about the shockwave therapies and combinations? I mean, we've talked a little bit about the PRP and the biologics. I guess there's also a number of places that are doing this thing with the shockwave therapy and all that. Any thoughts there?
Yeah, I think my understanding is that it can be effective. It's something we've looked into providing. There are some details that probably matter, mostly like the type of shockwave that's being used. I think there's quite a variety in equipment that places are using, anywhere from a machine that you can buy for $150 on Amazon to the $50,000 stores machine, which is, surgical hospital grade. So I don't know enough about the different technologies there, but I would guess that the actual FDA approved real machines are likely to be more effective than the $150 Amazon ones. And the thing is that people don't know, right? So if you say shockwave, you're offering shockwave, you're not lying if you're offering the $150 machine one, but
Mhm.
that's not, it's not necessarily effective. So I think, and again, I'm not the expert on this, but my understanding is there definitely is literature that shows it's effective. And I would guess that it's dependent on what actual equipment you're using. And the other thing is, depends on the etiology of your ED, right? If most, I would say, at least in my practice, now this isn't the general population, but in my practice, most people that have ED is probably psychosomatic.
Mhm.
Young, healthy people that for whatever reason are just having trouble with that. So that's usually can be helped actually by things we're doing by just making people feel better.
Well,
Whereas, sorry, go ahead.
sorry. Well, you bring that up, psychosomatic, and I seems like a lot of younger people are on things like antidepressants and Adderall and Xanax and all that stuff. Would you say that those have a role to play in somebody experiencing ED?
Certainly, yeah. Drugs is one of the causes of ED, especially the antidepressants and Adderall and all that, as you pointed out. I just mean in my patient population, most of my patients do not take any medications and have like nothing. But yes, and of course, the older you get, the more likely you are to be on some sort of medication. Um, Certainly, if you're on anything and you have erectile dysfunction, though, that's like definitely high on the list of possible reasons that you're having that. Um, so I guess the treatment for someone that has ED that's on beta blockers or
That
an
could,
antidepressant is to stop taking those medications, but unfortunately, that's not always realistic. But if it is that you're on an antidepressant and so where I was going with this is that if you're on an antidepressant or if you just have, if you're having a bad year and you have some, performance anxiety or depression or something, having shockwave therapy is not going to do anything for you. Um, if you have ED because you're 80 years old and you just have regular aging of all your tissue and mild vascular disease and whatever, then shockwave might actually be exactly what you need. And so the older you get, the stiffer your blood vessels get, and then that's why you have things like strokes and heart attacks, and in those, and you also get ED, and in those cases, shockwave can be helpful.
So, but you're saying a lot of the patients that you see aren't necessarily on chemically altering prescriptions or whatever, but still may have psychosomatic ED. How do you address that?
Well, it's so I mean I can't address. I'm not a
Don't go
psychologist
there.
or a
Don't go there.
psychiatrist. Yeah, I can't. I can't. I mean, basically there's my point is that it's actually treatable without any medical intervention, right? So it could be that if you have just some performance anxiety and you get some filler put in your penis, that solves everything, right? I'm
Okay.
not saying it's a treatment for it, and I would never say get this done and your ED will go away. But I'm just saying that when people feel better about themselves and it is psychosomatic, that's clearly going to be helpful.
Got it.
And so I see that all the time, right? It's just they get this done and everything's better. And again, it's not because we directly affected that, it's just feeling better helps. So
I'm probably going to regret asking this, but with porn addiction being what it is, do you find that to be a role in ED issues?
I wouldn't be able to say one way or another because I don't, I don't know how much porn my patients are watching or if they're addicted or not addicted. And I actually don't know how many of them have ED or performance anxiety or anything like that. I'm
An
just,
interesting study for you to delve in.
yeah. Well, what I can say is that it very almost certainly affects people's perception of their size and where they're at compared to other people, because obviously what they see on these, movies or clips or whatever is like completely not representative of the general population. So we see a lot of guys come in and they think they're small and they're like totally normal, if not even large in size. And so that certainly has something to do with it. And I always I try to address that by I'll always tell people like you're totally normal. Now, if they still want to have a procedure anyways, that's great. Everyone that's normal can have our procedure and just get better than normal. I mean, that's really what we do, right?
Optimal.
But
An optimal.
right, but exactly, but we just don't want people to think that you need this, right? That you're like not normal, and therefore, if you have this done, all of a sudden you'll be normal, because that's actually not the way it works.
Well, I saw on the site that you actually have a size calculator.
We do. That is based on what we think is to be the average length and thickness, and it's meant to kind of estimate if you get filler put in, like how much filler you would need to get to a certain size, and it gives you percentiles. Of course, I don't. That's not a scientific calculator. People should not use that as
Okay.
fact. And people do. We get text messages all the time, like, should we? Hey, I'm putting my penis numbers in this calculator, should be erect or flaccid or what. And it's like, I don't know, just put your numbers in and see what it says, right? It's not like based on scientific studies. It's just based on our experience of kind of knowing, okay, if you get this much filler, what approximate effect is that going
This
to
much
have?
enhancement. You're going to get this much enhancement.
Right. And we don't, I'm very careful not to guarantee that X amount of filler is going to give you Y amount of increase. I and my other doctors have experience to kind of be able to estimate, but everyone's different. So it's basically like the calculation. Well, it's not a calculation, but what I explain to people is the starting size of your penis is dependent on of the effect that the amount of filler is going to get. So the analogy is like if you take a balloon and it's at its like small size that comes out of the package and you put in one breath of air, it'll triple the size of the balloon. If you take an already blown out balloon and you put a breath of air in it, it does nothing. So the analogy is like if you have a super huge penis and you get a little bit of filler, it's not going to do anything or it'll be very minor. But
Hmm.
if you have a really small penis and you get that amount of filler, it might substantially increase the size because you're just putting a material you're putting material in the penis. So it's going to get the amount bigger as the volume of filler you're putting in.
Right. So, what you said people will do, men, let's be clear, men will do anything to have a better penis experience. So, what are the most radical things that you've experienced in your practice?
Well, to be clear, that doesn't mean all men will. That means there are men that will do anything.
Right, right.
Okay.
But it would be a
So,
man, not a woman. I'm just saying.
well, I'm an anesthesiologist and I work in San Francisco and I've seen all kinds of things that women will do to get penises and vice versa.
Okay.
But that's just, I've digressed there. That's not what we're talking about. The Really the extreme thing that people do is get these silicone implants put in. Um, it's it's extreme because if you almost everyone I see has a normal sized penis. By definition, right? Like 99% people have a normal sized penis. So um, I do have guys come in and they've got these silicone implants put in and they disfigure everything and make it look not natural. And in order to put those in, like I said, the skin has to be cut and degloved, and then this thing has to be put in and it then sewed back in. And so it's just a very kind of extreme way to get a little bit thicker. Never do surgery on a normal part of your body, right? It's like, it's kind of like saying, my knees are just fine, but I'm going to get a knee replacement because maybe they'll last a little bit longer. Well, that's a horrible idea, right?
Sure.
And it's not exactly the right analogy, but it's similar to that. Just don't touch it if it's working fine. With surgery, with injectables, that's different.
Trip, do you have anything else?
If it ain't broke, don't fix it.
Exactly. I like that.
So funny. Well, what is one thing that you would like the listener to know?
I did have one more question. One more
Yeah,
Oh,
go
question.
ahead.
I just asked you if you had a
Yeah,
question.
well, it just popped up.
Okay.
So sensitivity and all of that, I guess. Have you had any reflections after the filler placement? Any change in sensitivity or any thoughts after kind of post procedure complaints?
Not complaints. Actually, by injecting filler and making the penis thicker, people get more sensation. Their skin is not more sensitive, but the cylinder that they're using is filling the hole that it's fitting in more tightly, right? So there's more contact pressure. So in other words, that gives you more sensation. Um, on the other hand, some of these surgeries absolutely decrease sensation because you're cutting the skin, right? So you just cut through all the nerves. We don't cut anything. So no, the sensation is good. What I would like people to know is that this procedure that we do is it's fairly low risk. It takes about 45 minutes to an hour. And it's not meant for people that have, what I should say is that it's meant for people with a normal penis. Now, a normal penis can be 3 inches long and 3 inches thick, and it can be 9 inches long and 9 inches thick. Everyone can benefit some amount by getting dermal filler put in. It's enhancing what you already have. So that's the important thing to know. Don't look at this and say, oh, I'm fine. I don't need anything. Yeah, you don't need anything, but people that get this done increases their sex life, confidence, increases their appearance. And it's something that if you do, you can have more fun and just make yourself feel better and It's just similar to women getting breast implants or getting filler put in their lips or face, right? It's not necessarily that there's anything wrong. It's just something to enhance yourself.
Very cool. And then where can the listener find more about you and your services?
Well, we have a website, www.upsizematters.com. If you go to that website, there's obviously all sorts of information on the procedure. There's some videos. There's a link to podcasts, including this one. There's a doctor finder page where you can enter the city closest to you, and it'll show you who the doctor is in your area. Also, there's pricing information, and you can book an appointment on the website, or you can call or text us with the information that's on there.
Awesome. And listener, obviously have that information in the show notes as well. Right. Well, Dr. Pash, thank you so much. Learned a lot of things I never knew.
Thanks for having me. It was fun.
Awesome. All right.
Great
Listener,
stuff. Thanks so much.
Educational, informational, and somewhat entertaining. And until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.